This video is to show you how to adjust your new 3D printed nylon appliance. You may not need to make any adjustments to your appliance if your jaw is already sufficiently forward when you receive it. By bringing the jaw further forwards, you have the potential to decrease your level of snoring and tiredness. Once you've adapted to the appliance, which generally takes maybe 7 to 10 days, you can then make your first adjustment. Sometimes your dentist will have given you some other information and some other tips about when you can make your first adjustment, so please keep those in mind. To bring the jaw forward, the adjustable component is on the side of the upper appliance here, and you can see that there's a block and an insert, and we can use this tool or any other tool with a fine sort of a tip on it to lever the insert out of place. On the inside there you can see that there's a number. It's the number 0 here, which is typical for what you'll see on your appliance when it hasn't been adjusted at all by you at home. What we then also have in the kit that you'll receive will be some other blocks, some other inserts rather, which have different numbers on the inside indicating how much further forward in a number of millimeters they will sit compared to that original insert. So this would hold your jaw 1 millimeter further forwards. So to put that into place, you slide it around with the number facing the inside there. It can slide into place and just make sure it pushes in and sits flush there on the side. And then you'd repeat the story on the other side and make sure that you had the same size insert in both, and that is going to work to bring your lower jaw forwards in this sort of direction. And then if you need to, at 7 to 10 daily intervals, you can change it for the next size insert as well. It's important when you're going through that sort of adjustment that what you want to keep in mind, that the goal is that you can have your jaw forwards to the point that it's giving you the maximum relief from your symptoms. But in doing that, we don't want you to bring your jaw too far forwards, because that can increase the chance of you having side effects. So we want the maximum relief of symptoms for the minimum amount of movement that you have to make forwards in your lower jaw.